Hi everybody, my name is Jeannette Hart and I practice rheumatology here in the Tri-Cities. I'm also an active member of CBRC's Medical Advisory Board. We want to talk about being active with rheumatoid arthritis this month and the importance of exercise while managing the disease. Exercise is a proven way to reduce the symptoms of morning stiffness and to improve daily function. Let's start with talking about stretching. One of the hallmark symptoms of rheumatoid arthritis is morning stiffness. So being able to wake every morning, get your heart rate going by maybe just marching in place, followed by a short stretch can really improve that morning stiffness felt by rheumatoid arthritis patients. Then we can talk about walking. Walking is really underestimated exercise, and I like to call it intentional walking. Walking can be done at a very fast pace to increase your heart rate and improve your cardiovascular fitness, or it can be done in an intentional way where you are thinking about your core muscles and every muscle you use when you walk. Walking can be done at whatever pace feels comfortable, and it's a great exercise for patients with rheumatoid arthritis. And then I'd like to talk about flow movements. So when I talk about flow movements, we think of yoga or even Tai Chi. Both of these practices include breathing exercises. And so through breathing and movement, stress reduction can occur. And we know that patients who have rheumatoid arthritis or inflammatory arthritis are at higher risk for cardiovascular disease. So I like to emphasize flow movement when trying to reduce stress. Through flow movement, balance can also be practiced, and these movements can be done with bare feet and kind of improve the strength in the feet as well. Then we can talk about water work. So we know that water can support the body weight of a person, which may allow for more gentle movement and full range of motion. Water also acts as a natural resistance, so you can use water almost as a strength training. Next, into cardiovascular work. I mentioned the higher risk of cardiovascular disease in patients with rheumatoid arthritis or inflammatory arthritis. So trying to manage your cardio work is really important. Consider using a stationary bike, a recumbent bike, even an elliptical. These are great ways to increase your heart rate without pounding on the joints. And then let's talk about strength work. The joints are supported by muscles, and oftentimes patients with rheumatoid arthritis have experienced swelling in those joints. So it's really important to focus on the muscles to help tighten up the joints and reduce the risk for laxity or even deformity in the joint through the disease process. If you have not practiced strength exercises, I would recommend looking into working with a trainer initially to ensure that you're doing these exercises properly, therefore you do not cause any further damage in your joints or cause injury. And then with rheumatoid arthritis, we often think of the joints of the hands and the feet. So don't forget about these small joints, they're very important. So consider doing putty work at home, working through frozen rice with the fingers, intentionally moving all of these joints. And again, when we talk about the feet, I'll go back to those flow exercises. So the Tai Chi or the yoga, that can be done in bare feet, really working on weight bearing throughout the whole foot and your balance. And then the last one is flare. Can you exercise when you're in an active flare? And this is really should be managed sort of case by case. If you are having a mild flare that consists of joint pain and swelling, maybe one or two joints, just modify your exercise that day, not to exacerbate the pain. If you are in quite a large flare, it's more important that you contact your rheumatologist to manage that flare than to do your exercise regimen during that time. And then the last thing I wanted to touch on is appropriate shoes or any braces you might want to wear during exercise. So if you are going to exercise in shoes, make sure you have adequate support through the arch and padding through the ball of your foot, especially if you've lost some of that fat pad in the ball of your foot. And then if you like the feel of compression, I have lots of patients that like to wear compression gloves for those small joints when they exercise, or even a neoprene type sleeve for maybe the large joints like the knee. I hope that this has been educational for you all, and I look forward to seeing you at CBRC.